Good morning. We'll call the Health, Human, and Social Services Committee to order. First thing on the agenda is the approval of last month's meeting. If someone would like to move that. Supervisor Stoffel. No, I'm sorry. Supervisor Lowe.
Better look.
Seconded by Supervisor McGowan. Any additions or corrections to the minutes? All right, all those in favor?
Aye.
Aye. Opposed? Carried. Chris?
Good morning.
Over to you. Good morning. How are you?
I'm good. How are you?
Fine, thank you.
So I have a pretty light agenda. The only item really that requires any action is a request to amend the county budget. And this is for Trade Act funding for new members of the committee. This is a reimbursement. Dislocated workers are eligible for Trade Act funding through the federal government, and we get reimbursed to pay for their education. And this is someone who's actually been in school for a while, and it's the final $1,000 for their scholarship. It was a former laid-off GE worker who's attending SUNY Adirondack.
All right, someone like to make that motion. Supervisor Sopel, seconded by Supervisor McDevitt. Any discussion? All right, all those in favor?
Aye.
Aye. Opposed? Carried.
And then I just had some two informational items. The first one is a newsletter that we just printed actually the other day, even though it says January. We actually did this in-house. In the past, we've had it printed by Brennan's Quick Print, but there's color copiers up in the Human Service building that we were able to use. We printed these off, and you know, it's just for your information. It does tend to highlight the youth program fairly heavily, but also the main story is the machine tool training. I'm not sure if the committee is aware that the machine tool training program was awarded an award last fall by the New York State Association of Training and Employment Professionals. And this is a program that we've been running for the last 4 or 5 years. It starts in the fall and then ends in spring. And it's really like an apprenticeship program because it's an evening class that workers attend Monday through Thursday and then every other Saturday. And at the end they get certifications from BOCES, and we've had great luck with them finding jobs in the field. Nice. And the other handout I have is just an overview of the Workforce Development Board. And again, it's for your information. It's something that the board put together, and I think the board is because of the new legislation, is going to be more active. So you're likely to see them have a little higher profile than they may have had in the past. As you may recall, this committee in the Warren County Board of Supervisors does appoint about a third of the Workforce Development Board members. I'll be coming back in June for the reappointments to the group. I think there's 2 or 3 that are up for renewal. That's all I had, unless there's any questions.
Supervisor McGowan?
Yeah, Chris, I want to thank you very much. This is a really nice information thing you put together too. But the machine tool training. Obviously, this is a key thing that we all need, because the hands-on trades are, what I do is a dying breed of people being on. And I'm wondering if there's other programs too that we can just, like the welding. We have the apprentice programs for pipe fitting and that, and the electrical unit. I mean, those are other things that we can, you can look into.
Yeah, those are all things that we do. Interestingly enough, even though we've had great success with the machine tool program, with people being placed in the field, we had a hard time filling the class this past fall. In fact, right up to the last minute, it was almost canceled because of lack of interest.
What really amazes me with the machine tools is, it's really nowadays with these machines, especially over there at Sealy. They got machines bigger than, huge, but they're all computerized. Yeah. And if anybody's, is in the computer and, algorithms and that, this is a great program. So thank you.
Yeah, you're welcome. We have coming up. I didn't bring flyers for it, but we have we work with the city of Glens Falls. They received a grant to do hazardous waste material handling. we have that training program coming up. We have orientation meetings this week and next week in our office. We help with the recruitment and then with placement after the classes are over. But they receive industry certifications in hazardous waste material handling. Try to help them find a job. But it's similar kind of thing. The hope is if you have additional certifications that you'll be, it will improve your employability and also improve your wages. So we're always looking for those opportunities.
Well, thanks for all your help.
Yeah, thanks.
Supervisor Devitt?
The event that they had at the steam fitters, now, what was that training that you and I attended?
That was the EPA training. Yeah.
Okay. And that was to enable people to...
Yeah, so originally the city received a grant, and it's a federal grant from the Environmental Protection Agency.
Okay.
And they tied it in with the cleanup that was going on the Hudson River.
Okay.
And we actually didn't place very many people into that because it was already well underway by the time the grant was up and running. But we have been able to place people in some of the local cleanups. Fort Edward GE plant, for example. The Rutland GE plant was another example. And there were some other projects down in the Albany area that we were able to place people in a couple of years ago. But yeah, that's what it
That was that.
Yeah,
Okay.
the EPA training.
Supervisor?
Yes, thanks so much. Hey, Chris, I'm looking at the Workforce Development Board, and I remember back from years ago. You do a lot of work, they do a lot of work. It's all towards bringing the workforce and the employers together.
Mm-hmm.
They always seem to be working in the dark, as if there's a curtain between them. There should be at least, but there must be some sort of platform programming where everybody could put their data in. The employers could put, this is what we need, this is the training we need, these are the skills we need, and the people who are seeking jobs, this is what I have to offer.
Yeah.
We hear of jobs where one position and 80 resumes are entered. So in some cases, they know exactly what they want. In other cases, potential employees are just floundering around looking for potential jobs.
Yeah, there is a lot of truth to that, and there's a number of areas that we work in to help bridge that curtain, open that curtain, if you will. One was just last week with our annual job fair. We're one of the sponsors for Job Discovery, which we hold every year. It was the 30th anniversary at SUNY Adirondack. We had 82 vendors there, not necessarily businesses, because SUNY Adirondack was there, we were there. And we had well over 400 job seekers attend. One of the things that we've been doing the last few years is the businesses, when they register, they list the jobs that they're hiring for. So we're telling our job seekers to go in ahead of time to see what the positions are so they can be more selective in their job search. There's also computer programs. One is Job Zone, where employers can go on and list their job openings, but it's also tied with all the people that come in and file for unemployment are also using Job Zone. And so Job Zone can be used by businesses as a recruiting tool, and they can actually go in and search through job seekers.
That's done through
background. I mean,
go for unemployment.
Yeah, I mean, Indeed does that as well, and we still, tell all of our job seekers that that's really the best job search engine because they pull from all of the. I mean, when we listed our summer youth counselor, because it was posted on the internet, it ended up on Indeed. So it's a search engine that searches all the internet job listings and puts them in one place. And as a job seeker, you can go in and post your resume too. So technology is the way to help bridge that gap, but still face-to-face networking it's still the name of the game.
Okay, thank you.
All right, anyone else in the audience have any questions? Chris? All right. If
Thank you
not,
very
Chris,
much. Great
this is
questions.
great. I
Yeah.
like this
Yeah, thank you.
newsletter. Very nice. All right. Thank you. If there are no more questions,
Chris.
have a good day, Chris.
You too.
Most of you have in front of you the agenda for the social services. Let's go on to that next. There's only one item on there. I assume they all have one, right, Amanda? All right, what it is, they are in need of caseworker number 18, notice of intent to fill a vacant position in the foster care unit, employee number 11710, salary $49,327, grade 16, step 8, base salary $42,290 due to resignation effective April 5th. Rationale behind it is the position is mandated and reimbursed. If someone would like to make that motion. Supervisor McGowan, second by Supervisor Sokol. Any discussion? All right, all those in favor?
Aye.
Opposed? Carried. Thank you. With that, then, I think, Rob, we're going to move on to you next, okay?
When is our new commissioner? Social services.
They're starting,
Around,
April 6th.
I think it's going to be second. I'll check. I'm not sure the starting. They're all a little bit different.
Early April.
Oh, yes.
yeah, and he'll be here at next month's meeting.
Okay, thank you.
Thank you.
Good morning.
Good morning, Rob.
Okay, so I have one resolution request, and then I have a brief presentation if we're still okay time-wise to
Yes,
that
we
this
told
month.
you you could do that this month.
Okay, so the first item then is a request to amend the 2018 Warren County budget to allow acceptance and pass-through of 100% state aid funding from New York State OASIS to the Addictions Care Center of Albany in the amount of $289,921. This is to provide the residential substance abuse services.
All right, someone like to make that motion? Supervisor Loeb, seconded by Supervisor McGowan. Any discussion?
I just want,
Yes.
OASIS, can you just, the acronyms stand for?
That's the New York State Office of Alcoholism and Substance Abuse Services.
Okay.
And that's the agency that provides pass-through funding for substance abuse treatment and related services.
All right. Any discussion? All right, all those in favor?
Aye.
Opposed? Carried.
Okay, thank you.
Mhm.
Is there a remote that I can use for slides?
Pardon me?
Is there a remote I can use?
Should be right on top.
Okay, I'd like to introduce Harry Carlson this year as well. He's our Deputy Director of Fiscal. So we are the Office of Community Services for Warren and Washington counties. We're kind of unique in the sense that we're a shared administrative office between Warren and Washington counties. And you'll hear more about that as we go through. We do have a presence on both of the county websites, and you'll see information in this presentation that's pertinent to both counties. Okay, we primarily receive funding from 3 state agencies, and the New York State Office of Mental Health, the Office of Alcoholism and Substance Abuse Services, and the Office for People with Developmental Disabilities. The way that we're set up, organized, governed, structured, etc., is specified in New York State Mental Hygiene Law. It's in statute in Article 41, and that directs local governments or counties to either provide or arrange for preventive, rehabilitative, and treatment services for the mentally ill, developmentally disabled, and those suffering from alcoholism and substance abuse. In our counties, we don't operate direct services, so we fall under the provide or arrange for. We do that through contracts. Article 41 also requires the establishment by the county of a local government unit, or LGU, sometimes referred to, and then given authority in accordance with Article 41 to provide or arrange for those local services. So our office is that LGU, or local government unit, given that authority by both Warren and Washington counties. As I mentioned, we're a shared local governmental unit. So Warren and Washington counties have executed an intermunicipal agreement a number of years ago which details the sharing of the one administrative office. Our administrative costs are total and split evenly between the two counties through an annual chargeback mechanism. So we're carried as employees of Warren County for payroll purposes, etc. Then we have that chargeback mechanism for Washington County to pay half the expenses. Okay, so Article 41 requires each local governmental unit to have a community services board. In counties with a population of less than 100,000, CSB can consist of either 9 or 15 members. Our counties each have 9-member boards. Community service board members serve 4-year terms, and the officers are elected for 2-year terms. So we have separate community service boards. They meet jointly, and for the most part, they discuss things jointly, etc., because usually their business relates similar business. But they do have separate officers, separate board members, and they take votes separately. So here's a slide that shows the staff of the Office of Community Services. See, we have 6 staff members. Currently vacant is our program analyst. We're in the process of reposting that. Here's a slide that shows our current Warren County Community Service Board members. Mental hygiene law specifies that the Community Services Board be made up of a certain mix of individuals who have an interest in the 3 disability areas that I mentioned. So we try to get representation from the community. We have some parents on there. We have some professionals, retired professionals. Schools are represented. SUNY Adirondack and BOCES are on our Warren County Board. We also always try to hold a slot for our County Commissioner of Social Services. So Maureen Schmidt is still in that slot at this point. At some point, she'll step out of that seat. Here's a slide that just shows our current composition of the Washington County Community Services Board, and again, you can see sort of a mixture of representation there from schools, some county departments, parents, professionals, etc. Article 41 of the Mental Hygiene Law also requires the direction and administration by each LGU of an annual local planning process. And this is accomplished through a subcommittee structure. We do post our annual plan on each of the county websites. The subcommittee structure follows the 3 disability areas, really, the mental health, substance abuse, and developmental disabilities. We also have a subcommittee established specifically for children and youth, significance of their needs and issues. The Community Service Board subcommittees, this really provides a good venue for service system planning, also for implementation of new programs or coordination of services, for cross-system provider collaboration, information sharing, and multi-stakeholder problem solving. Subcommittees are made up of CSB members of the staff, service providers, service recipients, and family members, and they meet quarterly throughout the year. Subcommittee structure is also defined by mental hygiene laws, and the idea is to have a cross-system stakeholders there doing local planning and coordination. Okay, this is a listing of our 2018 Warren County contracts. So total just over $4 million, and these are local not-for-profit agencies that we work with. Again, they're all required to be part of the subcommittee process and for planning and coordination of services. Similar slide for Washington County. You can see Washington County contracts total a bit less, 2.5 million versus the 4 million in Warren County. Sometimes funding will come down from the state and they will run it just through one county versus both counties. But the contracts are held on behalf of the residents of the two counties. So anybody residing in the two counties is eligible for any of the services as long as they meet the eligibility criteria of the various programs. Okay, this is a slide that just shows the state aid versus county tax levy that's in the contract funding. So if we take out the admin funding and just look at the contracts that were on the previous two slides, this is how it breaks down between state and federal are lumped together there. You get a little bit of federal funding as well. But it's really in Warren County, 99% of it is state aid pass-through funding. The funding amount there for the county tax levy is $45,678. In Washington County, it's even a little bit less, so it's 99% plus in Washington County. If you want to see the breakdown of where that local tax levy funding goes, it goes primarily to Liberty House, receives the largest portion. Liberty House Foundation is pre-vocational program on Bay Street, Glens Falls. And then the Association for Mental Health gets a portion of that, and then Community Work and Independence. And primarily this funding goes to pre-vocational programming, helping people get ready or prepared or return to the workforce. And similar breakdown in Washington County. If we look at the admin funding, that is split between Warren and Washington counties, again a little bit differently there. The reason that it's not exactly 50-50 is that each county pays their own dues to our statewide association, so that produces a little bit of a difference. If we look at a similar breakdown of the admin funding, the split between state and federal aid versus the local tax levy. So for Warren County, we see $81,518, and then for Washington County, again a little bit less, but local tax levy is $76,000. Okay, another thing that we kind of keep an eye on, and I try to report back regularly to the committee, is the forensic evaluations. We manage a line in the budget related to these expenses, and as you can see, there can be pretty good variability from year to year on what we see in that line. If we look at 14 to 17, it looks like we kind of see a trend downward there, but it can really spike up in any given year depending on what type of orders we get. Primarily, the thing that drives the variability is the criminal court evaluations, you can see, and that's made up of different types of evaluations. What drives the highest cost is when we have individuals who are ordered for 730 competency exams, and fitness to proceed to trial. And if they're found not fit to proceed, they go to a state hospital, and there's a chargeback to the county during their stay of close to $500 a day. So that adds up pretty quickly. And in any given year, you might have 2 or 3. If that happens, then that's when we have the high numbers. This is a similar slide for Washington County, and you can see a sort of a similar pattern. There was kind of a spike there in around 14 in the last few years. Each of our contract agencies does maintain presence, of course, on the website, and now most of them have probably social media presence beyond that, Facebook, or whatever. So I would encourage anybody who's interested in services of any of the particular programs can search that out. If anybody's interested in seeing any of the programs, certainly at any time let me know. We can arrange for that. Our Community Services Board does try to move their meetings around, sometimes visit some of the agencies so the board members can see the programs. So if you ever notice that on the Board of Supervisor calendar and you want to come to a meeting, you're certainly welcome anytime. Some of the additional responsibilities of our office, just the fiscal management and reporting, single point of access process, that's referral process for high intensity, high level services, people with the highest level of need. We coordinate an assisted outpatient treatment program. This is what allows for court-ordered outpatient treatment. Individuals who have a certain need a certain criteria related to non-compliance with treatment, dangerousness in the community. Community Service Board and the subcommittees review certificates of need or requests for expansion of services, overall system coordination. We do emergency removals, mental hygiene law. Article 945 allows for police pickup orders. These are initiated by myself or designees when somebody's threatening to himself or others. They can be taken to the hospital for an evaluation. We coordinate a county disaster mental health team involved in the SAFE Act reporting. SAFE Act requires certain clinicians that are defined in the law to report through the SAFE Act portal when they think that somebody is likely to engage in dangerous behavior. So those reports come to myself and they get forwarded on to the state police and D.C. Department of Criminal Justice Services. We also have just an active involvement in various regional healthcare planning structures. These are things like the district that you hear agencies talking about, the Rural Health Network, different types of initiatives like that we want to make sure that we're involved in to help improve behavioral health care in the community. So basically that's it.
Thank you. Do any of the committee members have any questions? I appreciate him giving that overview because we do have new members on the committee, and I think it's good for them to have an idea.
Yeah, I just maybe like to make an observation if I can, and maybe a question to maybe enthusiastically support a couple of the organizations that are on there. Liberty House, for example, which works out as at the Methodist Church on Bay in Glens Falls, and some of the good folks that go through that program, you'll see them. You'll see them at Rice Chopper. You'll see them at Hannaford. You'll see them. One gentleman, I see him. He does the carts out in the parking lot. Okay, I see him at the Y periodically. He's a weightlifter. Okay, and he's so they. And just one vivid example I can remember. There used to be a young man that worked at the Hannaford on Broad Street in Glens Falls, and I'm on South Street one day. It's one of these days where it's 20 degrees out. It is snowing so hard you can't really see in front of you. And you see this young man, he's on his bicycle, okay? He's on his bicycle and he's going to work at Hannaford on Broad Street, okay? So it just, they're, to me, vivid examples of human beings that have clearly challenges in their lives, that the program has gotten them to a point where they're employable. They're not the store manager, but they're clearly working in a functional, gives them pride, gives us all hope, and in my opinion is clearly money well spent, okay? The other one is Waite House, which is actually in my ward in Glens Falls, where we are providing an avenue to support some young folks that are at risk, okay? So I would enthusiastically support your budget. That's my point. So.
Thank you, Mr. McDevitt. Anyone else, any comments? No, then I guess we're good. Thank you.
The last
Yes.
comment I would just make is that on the breakdown of the funding that I showed, the local tax levy and the administration, Harry had pointed out to me that those are budgeted numbers, and that actually, at least during the past year, we've seen an increase in the federal reimbursement. So if I were to redo those slides, maybe for next year, or to based on actuals from this year, you would see that wedge of the pie be even a little smaller, I think.
Sounds encouraging. Okay, very
Thank
good.
you.
Thank you. Have a good day, Rob.
You know what amazes me on that
We're going to do public health first.
or
The
anyone.
public health,
That wouldn't be-
okay.
Cynthia?
Cynthia?
Well, no. Just before you, do you have to run right out? I just need to talk to you real quick. They're going to be in their gas.
People in there.
I gotta get out some too or get it. No, you're not in trouble, but I just want to see how you guys do it, how we do it.
Congratulations, you know.
Well, I can, we can talk for you.
They do. They outnumber us.
We have good staff. We have good staff.
I noticed that the other day. I had a nice tour.
Can we just...
Andrea's.
Not running out back to
Yeah.
Funny bone, it was not funny.
Pat? Last one, Pat?
Oh, wait a second, did I? I had seven.
When I think it was Joan was here for a long, long time, right? And then you.
Diane was here.
Yeah, I came here in '06, so it was just you and you. I got you now.
Really?
That's why I had,
Okay, we're ready.
Okay, good morning, everybody. I guess since we're on first, you've already approved the minutes, so we can move on to the next thing. So the first thing we need to do on our agenda is to request a resolution to amend the contract with CDPHP to allow incorporation of a standard clause amendment and to authorize language that will allow future standard clauses to be able to just be part of the contract without any need for a board of supervisor, as long as it's approved by the county attorney. And that, most of our contracts have that anyway, but because when we did the one with CDPHP, it was a long time ago, so we just need to change that.
I'll move that.
All right.
Clean it up.
Second to that motion, Mr. McGowan. Any discussion? All those in favor? Aye. Opposed? Carried.
Okay. The second thing, we need to authorize in a contract agreement with VNA Home Care Options so that we can get reimbursement for services to people who are enrolled in their Medicare Advantage plan. No downside to that. They pay 100% of the Medicare rate.
Would someone like to make that motion? Supervisor Sokol, seconded by Supervisor McDevitt. Any discussion?
question.
Mr. Loeb.
I didn't have this to make a note on. I'm looking at the computer. Which resolution is dealing with the early intervention? Is it the DNA?
No, that's the early intervention one is through the State Department of Health.
Okay, I have a
That's
question
next.
when we get to that.
Okay, we're next.
Okay. So,
Okay.
any other discussion? All right, all those in favor?
Aye.
Opposed? Carried.
Okay, now we'll move on to, we are looking to ratify the actions of the chairman of the board to reapprove the provider agreement for early intervention services. They've never asked us to complete an application, but they sent one this time and we filled it out. It just basically allows us to keep doing what we're doing and to be reimbursed for the services that we provide, and it is mandated services. So it's due on March 30th, so we didn't want to get them upset. So, we just...
Motion made by Supervisor Sokol, second to that, Supervisor McGowan. Any discussion? Mr.
Question.
Loeb.
Yes, thank you. Madam Chair. Regarding the contract, you look at it, there's 24 points in the contract, and 20 of them deal with the provider must do these things. Some of that has to do with fiscal action, some with legal action. At least 10 of them to do with the actual care of the client.
Right.
Now, I'm not sure who the provider is. When it talks about the provider, the provider's employees. And what my question is, are we 100% sure that the provider's employees know exactly what they're required to do as opposed to
Well,
provider
we're the
hiring
provider of
parties,
the,
so to
no,
speak?
we're the provider of some of the services. Right.
health department.
The health department is. And our people would be our employees that are the service coordinators or some of our therapists. And some of the therapists do their own billing, so they would not be our employees. So we're only talking in this. And then also the state does pay for some of the services that are not covered by insurances. So this application, it's kind of a one size takes everything. But no, we're not obligated to do anything that we're not supposed to be doing.
But do all the people who are hands-on with the clients, do they know exactly what's in this contract? Because it seems that it's pretty explicit.
They know what they have to do. I mean, they know what kind of documentation they need to submit to the state, and they do it electronically. It's up to the state to make sure that they're doing what they're supposed to do.
No, that's not what I'm asking.
I think, Bill, we've had this where we go out to different contractors and they get audited on the services they provide. I mean, isn't this part, Pat, didn't like Prospect do some of this?
Yeah, and
Yeah,
they're actually coming to us the end of May, and the state goes out and monitors contractors as well.
Right. For certain aspects of this early child intervention, they have to do hearing for certain individuals, and I believe the state goes in and audits those programs. And we had some issues one time with, in the past, with one of the programs and on an audit, and it was all straightened out, but changed providers. I think they're pretty in-depth on that.
You always have the option to go out and do them yourself, but it's labor-intensive and it's expensive so it's really overkill.
Well, in one of them, it talks about the provider, meaning the actual practitioner who's working with the client,
Right,
must provide the family with this opportunity.
correct.
So there's a whole list of things.
Right.
And I just want to make sure that we know that the people who are actually hands-on with the client know they've got their checklist.
I guess I could say I'm as comfortable as I can be. I mean, is there a possibility something could be a problem at
But
some
I think
point?
public health also goes in and looks over the shoulders of our providers and makes sure that they are doing exactly what is required of them. I mean, we've had that issue before, and public health has found that, and we've made a few changes in the past.
Like we run all of our people through the child abuse registry, that sort of thing. Every year we do certain in-service type things, corporate compliance and those kind of things. I guess I'm comfortable. I don't really.
Janelle, you wanted to say something?
Thank you.
I was just going to say, when we get a new therapist, we run them through a very good orientation, and that's followed up by annual orientations and then services. In addition to, extra training as updates come out, because that might be what the contract says, but then we get a lot of nice updates from the state throughout the year. We hold regular therapist meetings so that we're able to share with our providers. Eric Mastriani with our early intervention program does a phenomenal job of staying on top of all that kind of management position. So anytime there's feelers or changes out there, he's communicating them. So to the best of our ability, we're on top of it. But the state is the first when they come in and do our surveys.
Okay,
Tell
thank
us
you.
if we're doing it or not. And we hold our changes accordingly.
Thank you.
Thank you, Janelle. All right, all those in favor? Aye. Opposed? Carried.
Okay, moving on, we'd like to request a contract with Patricia Elliman to provide occupational therapy services, and also to authorize a contract with Lindsay Maresca to provide occupational therapists. And again, we continue to need occupational therapy services and don't want to be in a position where we can't accept patient referrals and their billable services.
All right, Supervisor Sokol makes a motion, a second to that, Supervisor McGowan. Any discussion? All right, all those in favor?
Aye.
Opposed? Carried.
Okay, moving on, we need a resolution for budget amendment. Tom, do you want to talk about that?
Attachment number 5 is amending the current budget for our district funds that we did, were supposed to receive in 2017, but we will be using them this year, so we have to amend the budget to move them from last year to this year. Tammy, I don't know if you want to explain this or say anything more, but...
We've, as we discussed last year throughout the year, the funds came at a good time for us. We are going to change the platform that our current electronic health record is on, and we'll be able to use those funds to do that piece. There probably won't be a lot of equipment, but there could be equipment, but certainly the training, we're going to have folks from our software vendor on site for us, probably over the course of like 4 weeks. There'll be a few people that are on site. So we're going to be able to take care of this transition using those district funds that we received in 2017.
All right. Would someone like to make the motion to approve that? Supervisor McGowan, seconded by Supervisor McDevitt. Any discussion? All those in favor?
Aye.
Opposed? Carried.
Okay, we don't have any pending items, so moving on for our information for discussion. Tom, you could talk about our expenditures and revenues and comparison report.
Okay, attachment number 2 is our current status within 2018. It does still show you prior year for 2017, which we still are waiting for our WIC program for food vouchers and our preschool program, where, again, both of those come from the state, and April 9th is when the WIC will be available, and we can finally book those numbers. I'm estimating those two to be about 1.3 million more in revenue that we're going to see. So that's good for that. Regarding our salaries, down at the bottom, you'll see due to the contract negotiations, obviously beginning of the year, people have their increases. But at this point, we are 15.38% of the current budget, and last year at this time we were 17.59% of the current budget. So overall, we're doing well there. The next attachment, which is 3, you'll see kind of like a snapshot of last year at this time to this year at this time. In most everything, you'll see where we're up in the regular salaries, we're down in overtime and part-time salaries. Equipment about the same. Contractual, we're up, but I can tell you that the contractual expenses, what's up is the rent. We paid rent this year in February, and last year we did it like the end of March, so it's not, so you can see why we're up in that case. Also, employee benefits, we're down right now. Again, that's the savings right now that we're saying we had when we have positions that are valuable and the fringe benefits related to that. Right now, we're using per diem as much as we can. And the revenue, you'll see we're less than $500 difference last year at this time, so we're right on target right now with last year. So. Very good.
Okay, thanks, Tom. Anybody have questions?
Why not?
I guess we'll move on then to attachment number 1, our emergency response and preparedness. Attachment number 1, you'll see do every month. Things that have been going on. I do want to bring your attention to the fact that there will be a drill coming up that we're recruiting volunteers for. It's the last thing in your packet, so if nobody is doing anything on that day, it's on April 3rd from 9:30 to 11:30. Including any of our guests back here. If you'd like to come and participate in our drill, we'd be happy to have you. If anybody has any questions on that? Okay.
Yeah, oh, I
remember 2 or 3 years ago we did the same thing. Is it every, are we mandated to have it every?
Oh yeah, it's part of the contract deliverables for the emergency preparedness. And this will be a little bit different. This one actually might be a little more exciting. Before, remember, we walked around. This one, Janelle, maybe you can give them a little snapshot about what's going to actually happen.
I don't actually have to go there again.
We're looking forward to you going again. This is, from what we understand, going to be more of an immunization-related drill, which is the drill that you participated in the last time with the medication dispensing drill. This would be more if there was prophylaxis that required a vaccination. So we're going to be giving mock shots, so everyone will have to have a real needle. So we're basically testing our ability to get notified there's a crisis, send out an alert, create a clinic, organize that clinic, run the clinic, and then we have to show a certain throughput through the clinic. So similar to the last one where we have people walking through several times, if we have volunteers that can do that, that would be helpful. We set up some really nice names like Mickey Mouse and things like that I'm going to go through as. And some of them will have like language-related issues, special needs-related issues that might take more time. And we're hoping to be successful and learn from the drill and address any concerns that we
Okay, keep that in mind if any of you want to participate. Mr. McGowan.
Geez, I was hoping there was going to be some real blood involved, but...
Should have known.
We don't want that to happen.
Right.
Okay, moving on to the status of referrals. Val, do you have anything you want to talk about with that?
The one good thing was, they were up 10% from the same time last year in January. Well, we, under the skilled nursing evals per month. Last year at this time we had done 123, and this January we did 133. Business seems to be keeping everybody busy. Continue to get referrals from Albany Med and St. Peter's, and when we tell them that we'll get a nurse out there the next day, they just say, oh, you can. It's like it's surprising to them. And I just keep reinforcing to them, so remember who you're calling and keep us our name and call us first.
Gotcha. What are we talking about with the referral?
When we get patients coming from the hospital or the doctor's office, we call it that they're calling in a referral, so that would be a new patient.
And then we go to their home?
Yep.
Okay. Thank you.
Okay. Attachment number 6 is the 2017 rabies program report. And this is the report for the entire year. So if anybody has any questions on that, we could do some changes, as everybody is aware, with the way the follow-up on site. So this basically gives you a summary of exactly what we did.
And what do we do again? Okay, just refresh me one time. Now, let's assume there is a dog bite, that it's referred to you guys, and then what's the step after that?
Our community disease nurse will verify the rabies vaccination status.
Okay.
Whether the dog is vaccinated or not, we initiate a confinement and initiate a letter being sent to the owner, of which we copy the count and we copy the victim.
Okay.
And then at the end of 10 days, we assign an animal control officer that has been hired by our agency, kind of like a per diem or per bite like basis. And they verify the whole status within the 10 days. If it's a different owner, different victim. If it's same owner, same victim, same address, then our clinical disease nurse touches base with the family within the 10 days to make sure the dog's healthy. If it's different owner, different victim address, we assume that there's usually the objective animal control officer and their verify the health status. And then we go back to the victim. If the animal gets sick or dies within the 10 days, then we authorize rabies substance to be sent out so that we can ensure that the person is administered rabies.
Now, is that policy throughout the county, Warren County, all communities? Same thing. Good.
We updated the rabies plan and the county rabies plan. And that's something the state will require.
Thank you.
Supervisor Beatty.
What is the cost of running rabies in a 10-day process? First of all, I assume Warren County absorbs the cost, correct?
Well, the quarantines take place at the owner's home. So there's really not a major cost associated with that, with the exception of our nurse doing the upfront initial investigation, making phone calls to verify the rabies vaccination status, initiating a letter. There's some staff time associated with that, but we've been doing that for my entire tenure here. As far as expenses, if the animal has to be confined in the animal hospital, if there's an owner, it's an owner expense. If it's a stray, then it's a county expense. We hold rabies clinics that are actually free, but we ask for a donation for anybody that's willing to provide that donation. A lot of the revenue from those clinics goes to the staffing of the clinics, pretty much equals out, or might provide a little extra money that can help cover some of these financial costs. Tom can maybe speak to how much the rabies program actually costs us, but the biggest expense of the rabies program is the rabies post-exposure prophylaxis. So if somebody gets exposed to a wild animal, or if somebody gets exposed to a dog that we can't locate within 10 days to verify that it's healthy, we have to pay for rabies post-exposure treatment, which is an immunization series. And the first visits at the hospitals, if they're insured, they go to the hospital for the remainder of the doses of the 4-shot series. If they don't have insurance, they come to the county where we can do those last 4 shots, or the last 3 shots. Insurance hopefully pays, but we get stuck with what insurance doesn't pay, which also includes the copay. And right now we're seeing the new marketplace insurances have high deductibles, so if they've been exposed to the here, a lot of times we get 100% of that bill.
You gave me a lot there. Okay, so I'm trying to
It's a huge
digest
program.
Okay, yeah, it's very complicated. So, getting back to the cost thing, so insurance, the individual's insurance will cover it.
The post-exposure treatment.
Which is pretty expensive, right, to have the rabies shots and so forth. What roughly would a rabies shot sequence cost?
Well, it comes across, the first shot is the most expensive because of the current medications that they have for that first one. It can run anywhere depending from, I've seen 15,000 to 30,000.
Oh my goodness.
But they do not pay that. Insurance might pay you 1,000. The hospital has insurance agreements with these insurances, and maybe let's say they'll pay 3,000 on it. The hospital really writes off the difference. Any copay or deductible, we are responsible for. The patient is never responsible for anything. So, someone might have a $50 copay, and the 4 shots, I'll get, billed to $200. Or we had one family last year that had a $10,000 deductible to me, and it was in November, and they hadn't met anything, so I had to pay, because their child was also involved, but that was a different insurance. I had to pay over $6,000, almost $7,000. I do get a grant for the state for the rabies program. It's about $17,000. Like she said, what we collect at clinics helps offset for the veterinarians and the vaccines we have to give and the needles and all that. It almost covers the clinic, so that's a good note. Where the expenses and the rabies, of course, is the victims who have gotten the rabies. Like we said, if they don't have insurance, which I got to say, over the last 3 or 4 years, it's been rare, maybe 1 or 2 people who have not had insurance. They get that first one at the hospital, and we have a contract with the hospital for reduced payment. They might bill me $2,000, $3,000. They'll give me the cost of what their vaccine and their time is, and we pay that, and then the balance, they come to our county, and we get the vaccine, and we can give them the other 3 there.
And for the regular rabies bite, where we're just checking the dog within the 10 days, that costs us $40 a bite for the animal control officer to check the dog.
So,
And that has been working well.
okay, so it's a significant cost for the first rabies shot and so forth. Insurance covers it. We pay the person's deductible.
Or copay.
Copay. So I guess one of my questions is, I can see us doing that if it's a dog that's not their dog or something. Why would the county though pay? Let's say I've got a dog, okay? I've got a dog and my dog bites Matt. Matt will bite back, but anyway, dog bites Matt, okay? I've got insurance, okay, but I got $5,000 deductible. Matt's got to get rabies shots and goes through that process. So you being all of us in Warren County, will pay my $5,000 deductible?
No, if you still have your dog and we can check it within the 10 days, rabies shots are not needed.
Yeah, that's
That's
right.
why
healthy.
That's
But
why
if it's a stray,
that's why it's so important for us to be able to locate the dog at the end of 10 days so that he would not need the
Okay.
rabies shot. The situation comes when we're not able to find the dog, that the county's responsible for paying that.
Okay, now one other follow-up then is, every dog's supposed to be registered. Queensbury, which I know by law is supposed to be registered. So we got a dog that bites Matt, okay, that's not registered. We absorbed, obviously, you absorb the whole cost of that?
So again, if we have a dog, whether it's vaccinated or not, licensed or not, we check the dog and send it to him. And no shots are needed.
But if he needs the shots?
He would never need the shots if the dog is alive and well. If your dog got sick or died within the 10 days, we would send it off to be tested for rabies. The law enforcement lab doesn't charge anything for the testing, but we would have to pay the fee to get it prepped for the testing. And at that point, it would be an owner's expense. If it's a stray, it would be the county's expense.
And again, we have a grant with the state for rabies that helps off, we have a grant with the state for rabies that helps offset. All of the animal costs, if we have to send away for testing, is paid by the grant. And like I said, the human aspect, where you have to go to the hospital and get those, or the co-pays, again, all covered, in most cases, by the grant. If it's an expensive year and we get a lot of bites, it may go over the grant, and then yes, it falls on. But the state is trying to keep track of that. They want to hear about that, and they want to see if it's...
Okay, one final question. So the total amount of this chart that I'm looking at, we had 88 total dog bites. 2017, 36 matched. Am I correct so far? Okay. All right.
For the same address, for the same owner victim, like your dog that your child.
Okay, all right, so, what would, I'm just curious, what would be our cost, that all that, rabies, dog bites and cat bites and things, what was our liability, what was the county's cost? And I know it's some didn't have to go through rabies, some did, there's a lot of different scenarios. I was just wondering what our cost was as a county.
And you can come up with that with our annual report data, and as soon as it's available, I can send it out.
More of a curiosity thing than anything else, but I'm trying to...
Do you remember what last year's was?
Well, I was going to say probably the total by the time we get done with all the grant money we get in and everything else, I think it was in 1 year maybe like $800, in 1 year less than $2,000.
Really?
Yeah.
That little?
Yeah.
Our county exposure financially?
So far. I mean, if we get a lot of dog bites or we get a lot of families with those big deductibles, because that's why I raised the question last year that probably needs to be brought to the state's attention, that now a lot of people are getting these cheaper insurance costs but higher deductibles, which, God forbid, if there's someone who gets bit and the dog or animal was rabid, then it does fall on us. So, go ahead.
In addition to the rabies grant, rabies does fall under what's called the General Public Health Works grant for the state as well. So at a minimum, if we went over that grant of whatever it is, the $15,000 a year, at a minimum, the state would cover a third of the additional expenses as well, because it falls under rabies as a public health program, so any addition will fall under that. So depending upon, and we receive $500,000 as a base grant every year, Warren County Health Services does. So whether it be covered at 100% up to that 500, or just based upon all the other programs that we do, or a little bit more, and that's how we can kind of try to mitigate. But as Tawn said, I mean, if we had 20 people, they all had high deductibles, then, that's where we could run into a problem.
And actually, that is a trend, actually, having higher deductibles for people because of the cost of insurance. Okay, thank you very much. It's very important.
Okay, did you have a comment? No, you're good. Okay, we should move on, Pat.
Okay. Moving on to, we have an informational item. Back in January, we requested to carry over some funds from an opioid gateway closed grant that we had gotten from Adirondack Health Institute, since not all the funds were expended. And we recently did a program where monies were utilized to purchase food and supplies, and the total amount was $413. And Mrs. Fraser Grant allowed us to approve that, but as per the policy, we need to allow you to know that happened. So I guess I would call that informational.
Yes.
Okay. Moving on to our staffing update, and as we discussed our last meeting, staffing is always a challenge. Since our last meeting, our WIC program coordinator retired with 1 week notice. She took her vacation, and that is an out-of-bargaining position, and we do anticipate that might be a bit difficult to fill. Meanwhile, staff is adequate and knowledgeable, and the clinics will go on uninterrupted with more work from public health staff will be needed for the short term. We also had a WIC program assistant who resigned. She gave a 2-week notice. And that one, there is a list, so hopefully we'll be able to fill from that list. We also have an infant feeding advocate who resigned a few weeks ago, and we're in the process of ironing out the job requirements with New York State Department of Health, because they have a plan where they want to have somebody on call for breastfeeding guidance 24 hours a day, carry a cell phone, and they don't want to have a mechanism for compensation. So sometimes some of the WIC programs can do things that we can't do because we're civil service. So we're in the process of ironing that out. I also don't think we would be real successful in getting a coordinator to do that for no compensation. So we'll keep you posted on that. We also are aware of 2 nurses that are going out on extended medical leaves in the next several weeks. We have 1 nurse on workers' comp and may or may not be back soon. Anyway, long story short, we have 2 openings that we have not filled because we've been going along. We now need to fill them, so we'll be looking for your support to be able to do that.
So then we need a motion.
Yes, the 4 positions are WIC coordinator, WIC assistant, registered professional nurse number 1, and registered professional nurse number 39.
So if someone would like to make that motion so they can move forward with it. Supervisor Sokol, seconded by Supervisor McGowan. Any discussion? All those in favor? Aye. Opposed? Carried.
That's all we have for you.
Pat, what can I say? We're going to miss you. We certainly appreciated your many years of service to Warren County. You have run a terrific department.
And I'm leaving a terrific department, and you will not even miss me at all.
Oh, so we'll miss you, but we certainly wish you the best. And Kevin has a little something he would just like to present.
We have a certificate of appreciation presented to Patricia Auer on behalf of the Warren County Board of Supervisors in recognition of your more than 31 years of dedicated public service to the County of Warren through the Public Health Division. And Pat, we're going to miss you. And we had some fun times, we had some tough times, but it was always good. So congratulations, Pat.
Well done.
Yes.
Enjoy.
All right, thank you all, ladies. See you later.
Appreciate it, okay? Thank you now. The nurses ought to run the county. That's my proposal.
You're right.
They got it.
She does.
They are
Terrific.
How's everything?
You know what he was getting off of. We don't have
Maple syrup's coming good?
Yeah,
I gotta tell you about.
I guess.
you know.
After the weekends, it was just an honor system. We're not here, but, pick what you want, put your money in the basket. Walk out with $200 for the stuff, put our money in.
Okay, we're all set at Essex at all the farms. Okay, you fellas all ready? All right, Dee's ready. Okay.
Morning.
Morning.
First item on our agenda is permission to enter into a memorandum of understanding with RSVP of Hamilton County. This will allow us to collaborate with regards to getting volunteer drivers for the home delivered meals program and as well as the medical transportation program. And there's no monetary expense at all.
Right. Mr. Slow, seconded by Mr. McGowan. Any discussion? All those in favor?
Aye.
Opposed? Carried.
Number 2, we're just going to hold off on.
All right.
We're going to go down to the information for discussion or review.
And there are a lot of items here, so I kind of want everyone listening. I'd like your input. I know Dee would like our input on some of these items, so carry on.
So the first item, if you look at this sheet in your packet, we did a trial run with the Washington County meals on 2 of our routes out of the Glens Falls Kingsbury location. The meals were packaged in Washington County at 10:15. I picked them up at 10:26, and this was on the very bottom.
I arrived at the Cedar site at 10:43. I left Cedars at 11:02 because I was waiting for the meals for
Doesn't
Cedars
read
to
well.
be packaged. I then delivered both meals. We also had Mary Ann who delivered the last route of the day, so the last meals that went out. I delivered my last meal at 12:05. The temperatures for the Washington County meals were at 138 degrees for the beef and 128 degrees for the vegetables. Mary Ann, when she delivered her last meal at 12:45, the temperature of the beef was still at 138. The required temperature is 140 degrees, so we were below the required temperature, but we will work on that. But the thing I wanted to point out is that we had a delay with delivering the Cedars meals, or the Washington County meals. So we had the drive time from Washington County to Cedars, and then a 19-minute delay while we were waiting for the Cedars meals to be packaged. And the Washington County meals were still hotter than the Cedars meals. The Cedars meals went directly from the oven to the packaging, to the coolers, to being delivered, and their temperatures were 120 degrees. So they were 18 degrees lower than the meals that we got from Washington County. So while we do need to, if we were to go with Washington County, we would need to address the temperature issue. There's a bigger issue at the Cedar site right now, which we are trying to address. But our temperatures were much lower. I followed up with all of the individuals that got both meals for the day to get their comments, and those are all listed here. Overall, the meal was liked by most of the participants. There were a few that didn't like red peppers. Washington County had a beef teriyaki with onions and peppers over brown rice. Cedars had a shepherd's pie with mashed potatoes. So there was one person didn't like the red peppers, one person didn't like the fact that there was rice with it. A couple others didn't like that it was mixed together, and then some preferred the Cedars meal because it had mashed potatoes. Somebody liked the mashed potatoes. But overall, the recipients were happy with both meals. So I just wanted to give you an update that we did do a trial run, and overall, most of the individuals that got both the meals, they were happy with the Washington County meals. That will address one of the concerns that the constituents had about it.
All right, any questions from the committee members? All right, guess we'll move on to the next item then.
So the next item I wanted to give you was a rundown of each of the meal sites. It gives you a breakdown of all of their expenses by each meal site. It will also give you the total number. So this is the total expenses, and it tells you each category how much it was, whether it was equipment, foods, supplies, things like that, salaries. Then the next cluster here tells you how many home delivered meals we had, how many congregate meals, the totals, averages each day for home delivered and congregate, the total number of days that the sites were open, and each site is different because it's based on the school, the number of employees for each site. Then it also goes over what the county expenses are, what the lesser responsibilities are, so who we lease the site from, and then what's reimbursed by each town. And then finally, you have a breakdown of price per meal for each site. So like I said, one for each site. There's a lot of information in here, but I wanted to give you guys an idea of what it costs to actually produce the meals per site, and then what's involved with each individual meal site.
All right, but what you're saying, people who come for the meals only pay $3 for the meal.
If you are eligible for the meals, which means you're over 60, then you only have to pay $3 per meal, regardless of what it costs the county to produce the meals. If you're under 60, then it's $5.
Okay.
And that one you are required to pay the $5 if you're under 60. But if you're over 60, it's a volunteer contribution, so they are not required to pay, and we cannot force them to pay. It's one of the NISOFA regulations.
Any questions? I'm sorry, Mr. McGowan, I was just looking here.
Thank you, Madam Chairwoman. Is that a state locked-in price, or is that,
No, that's up to each county, but this is the amount that most of the counties charge. And as I explained before, it's difficult for some of our clients to even pay that $3. And some won't accept the meal if they can't pay it. So if we increase the price, we're going to see a drop in the people that really need the service from getting it. They're not going to get it.
okay, you answered my question.
All right, any other questions on that?
I would like to say, I have questions a lot of people.
Could we wait until, do you think we could wait until we're kind of finished with the discussion as a committee, and then we'll come back to any comments?
question.
Okay, Mr. Davis.
Thank you. So I'm looking to go over this, and obviously I see a major difference in the amount per meal per town. And efficiency of scale comes into play, just a little bit of business. But on the other hand, some of these don't make sense. For example, Lake Luzerne pays, they actually pay one of the employees from the county, the second person it says in there?
Correct. That's
Okay, so there's an option for a town to pay if they feel they need additional personnel? Is that what you're saying?
There's an option for the towns to contribute whatever they can towards each individual anyway. So for Bolton, for example, they reimburse us for all the snow removal, the sanding, and the trash. Lake Luzerne, they contribute an employee, and they pay for snow removal and trash as well. In Chestertown, they pay for all the propane costs and the trash removal and snow removal.
Snow removal from the site?
Yes. So you have individuals that come in and have the meals at the site. That's the congregate meal portion.
Okay. So, other than efficiency of scale, why else is there such a discrepancy in price?
It depends on how many meals you serve as well.
That's efficiency of scale. But in other words, payroll affecting this, it seems to me that maybe in some towns, a little high, the average price of a meal Bolton's $14.14.
Mm-hmm.
I mean, if I'm just thinking out of the box, and that's all I'm doing, we have Bolton, we have Chestertown, we have Cedars, we have Solomon Heights, Presbyterian, we have Jasper, we have Lake Luzerne. I guess what I'm thinking is, here we are thinking about dropping Cedars, going to Washington County. Maybe my way of thinking is, why aren't we taking some of these other ones in our county, and if Cedars has the ability to bang out more meals, why aren't we looking within our own county to do that, and to save on IE, keep the payroll in the county? There's a number of good things that happen from that. So, am I missing something there, Dean?
With Bolton, these numbers were from last year's figures, 2017, and we have made a change with Bolton since then. We have eliminated the second person, so that cost per meal will go down. We have reached out to Countryside Adult Home in Warrensburg, as well as Lake Luzerne, to see if they can incorporate some of the other meal sites as well, producing the meals but still having the congregate sites in each location. So we are looking at that.
We're looking at more in-house, i.e. Warren County. So I think we should really maximize those opportunities much before we start thinking about another county, in this case, supplying meals. I think where we're thinking maybe we should cut back at Cedars, I think maybe we should expand. I think maybe we should actually be bringing in, doing more meals for different parts of Warren County. Now that's just me thinking, but to me that makes a little more sense than saying, well, let's shut down our biggest meal site and go to Washington County. Tax dollars go there, all the other dollars go over there. I don't know if that makes much sense to me. Now, am I missing something?
No, but regardless of where the meals are produced, we still have to have an employee per site. So the savings are going to be about the same whether we go with Washington County, or if we had Cedars produce the meals, because you're still going to need the staff to transport the meals to the site and have the congregate location.
I get that, so why don't we keep it in-house, is what I'm saying. I'm all for shared services, you know, that's one of my big shticks, but this one doesn't make sense to me on the outset. It just doesn't make sense to me. So we need to share with Washington County in this regard. I think we have the facilities in Warren County to more than adequately address and maybe consolidate some of these other sites and have Cedars be the linchpin to be our offshoot to our satellite in staying in Warren County. That's what and I haven't done all the analysis, but I'm looking just at these numbers from an offset, and that's the conclusion.
I will mention that in the past, I don't know if it was with Christy Sabo or Candace Kelly, they proposed that idea of having a central kitchen, and it was voted down.
Okay, but the days are different and times are different, and I don't know what they did 5 years ago or 4 years ago. I'm just saying I'm dealing with what I see now, and I don't want to go to Washington County. Okay, I'll be right on the record.
Well, Doug, I think she is trying. She's told you how she's checking with Countryside. She's checking with Lake Luzerne. But you've got to remember, if these sites don't want to do it, you can't force them to do it either. So that also enters into it. But, you know, I think she really is making the effort.
I think she's making that effort. I just want to make an effort in county yet now.
Well, I understand that. I hear you, Doug.
Well, thank you. Thanks for interrupting me. Thank you.
Sorry about that. Dee? Any other committee members have any questions as far as each one of these meal sites?
Let me echo what Mr. Beatty said. Warren County Services ought to stay in Warren County. Plain and simple. Warren County can take care of its own issues. We don't need Washington County to solve what may or may not be a problem, okay? At the end of the day, in my opinion, this exercise should have stopped about a month ago, okay? We continue to talk about a so-called problem, and if indeed the criteria is we have to save $74,000, who established that criteria? How did we come up with that number? What was the common sense and the rationale behind that? We charge a good employee like Dee to find $74,000. Well, maybe we shouldn't have done that. Maybe the starting point of the whole exercise was fraught. And then we have, the ending point of a meeting with Virginia on, we have, I think, a complaint registered against a supervisor in this room, okay? I don't like what I see and what I hear at this point. And we ought to end this, end the insanity.
Supervisor Sokol.
Thank you, Madam Chair. Do you know if we understand if Washington County is on board with their board of supervisors? From what I remember, they weren't going to provide, I forgot. Maybe refresh my memory.
The issue with Washington County is it hadn't gone through the proper channels. It had all been discussed out of a committee, not within the committee setting. So they wanted it to be done within committee where they had all the information, and they are on board with it at this point. As far as speaking to Supervisor McDivitt, the reason that I was asked to cut money is because our budget was $150,000 over what it was last year. The reason why it was over was because of the filling and addition of personnel prior to my arrival. There were about 7 or 8 positions that were either created and filled or just filled. And that was across the board. So it made sense, and I agree that the budget committee asked me to see where I could find these savings because our expenses were going up.
Sure.
And we weren't having the corresponding funding for it. As far as whether or not it stays within Warren County or it goes to Washington County, I'm not opposed to looking at, but I think we should look at the fact that we're saving money. We're finding a more efficient way of doing it. I've explained this to other supervisors. If at your home you have your cable package, and you get the same, your cable package went up $10, $15 a month, and you were able to find a different provider that could give you the exact same service
at a lesser rate, are you going to stay with the company you had that went up $15, or are you going to change? I mean, you have to look at the figures, the numbers, what's fiscally responsible, not the personal aspect of it. And I think that's what Cedars is looking at as well, and I'm not faulting you for that, but you're looking at the people and not the fact that this is saving the taxpayers money.
I would certainly...
All right, any
I'd
other
just like to
committee
respond
member?
to what Dee just said, if I can.
Yeah.
She's responding to me, I'd like to re-respond to her. I'd agree with your cable TV analogy, no question about that. This is not cable TV that we're talking about here. I would ask any supervisor in the room, if someone said, why don't we eliminate that thing in Bolton? Why don't we eliminate it in Chestertown, Solomon Heights, Presbyterian, Johnsburg, Lake Luzerne? Why don't we just yank that program out of their community, okay? Senior citizens that have basically paid their dues, paid a price. So I don't see any other supervisors in the room jumping up and down saying, take my program from Bolton, take my program from Lake Luzerne, take my program from Chestertown, we'll make that contribution. I don't see that happening.
Let me make 2 points. We're not taking away a program. We're just changing who's providing it. And if you're talking about that, then perhaps the City of Glens Falls and the Town of Queensbury should contribute something to this. They don't contribute anything. Where Bolton contributes, Lake Luzerne contributes, Chestertown contributes, Glens Falls, Queensbury doesn't contribute anything to the Meals on Wheels program, the home delivered meals, or the congregated meals.
Maybe they contribute in other ways.
They don't. On this spreadsheet, there's nothing here that's contributed by the Town of Glens Falls or Queensbury.
Maybe Queensbury and Glens Falls, in terms of their taxable base, in terms of contribution to the county, maybe that's how they pay.
All right, I think we could go on forever. Mr. Beatty, and then we need to get a couple.
We were using that cable analogy, which is very, with all due respect, it's not apples to apples at all. You take $75,000 of payroll out of Warren County, you put it over into Washington County. We have the unemployment costs then, we have a number of additional costs, and we still maintain, we still absorb. So it's a significant dollar transfer, in my opinion, from one county to the other. That's all I'm trying to say. So it's not the hey, we're saving the $75,000. No, we still have legacy costs, we still have unemployment costs, we still have a number of different additional costs for those employees that now do not have positions. So that's more of a fair analogy, what I just presented to you, than the cable case. The cable doesn't make sense at all. I appreciate the work you're doing, Dee, I really do. And you were given an assignment. I didn't know the budget committee did that, or was it the budget director? Was it Mr. Thomas who gave you that? I don't remember voting on giving you a direction to cut $150,000.
It was during our budget discussions.
During your budget discussions that you had, okay. All right, with the director of your budget. Again, finally, I just think we need to find these $75,000 somewhere else. I mean, that's our...
Okay.
Kind of ludicrous. Please don't interrupt me, Edna. I know you like to, but please, let me just finish. I give you the respect. I'd like it back. Thank you. So, when we have so many other costs in this county that don't make sense, cutting $75,000 from our seniors is, in my opinion, absolutely ridiculous. So that's my final. Now, Edna, feel free.
Thank you, Doug. I was just going to say, Dee has some alternate suggestions that perhaps we could listen to what they are, a different way of saving the $74,000. Now that we beat the other thing to death, at least let's listen to her to see what else she has. Okay?
Before I address that, a couple of supervisors have asked me what contributions we get from each site. So this sheet here actually gives that breakdown.
Okay,
Good. You can look it up. We can't break it down based on individual. That's not allowable, but it does give you an idea of how much we get for each site. I don't know if there's any questions on that.
Amazing that
Supervisor. Conover, I'm sorry, I didn't see you back there.
I just wanted to know that what I got is that the staffing change phone is working fine. And that was, that dollar meal counts about 11, I think, 11
Yeah.
change, which is a good thing, I think, from a budget point of view. And I'm not sure how much more there is to drop here, because you still got to buy the food, you're still delivering X number of meals and whatever. And so that's where the scale, some scale comes into play in terms of, but mostly I think it comes into play on the food, not on the salaries. So I just want you to know that that's a modification in full.
So, next two sheets here.
Oh, okay, right.
Would be on one policy.
This one here kind of gives you, these are what the state requirements are for staffing levels at the meal sites. We've got them on there. It tells you how many hours you need, how many staff members, based on a 30-hour a week or a 25-hour a week scenario. And you can see that we're at those levels for most of the sites. So what we did is based on these numbers and the changes that were made prior to my coming on board, under item number 4 on here is kind of the other suggestion that we could come up with regards to saving the expenses across the meal sites. So this is for your information. Like I said, at Bolton, we already did change the numbers from 2 people to 1 people. Lake Luzerne, their numbers of meals are actually increasing, so we don't agree with making a cut there, whereas the other sites are decreasing. And with Warrensburg, we've already made changes as well in their hours. So it would only be Chestertown, Cedars, Johnsburg, where we could make changes in order to see the savings. The only other options would be to close down meal sites, which again is still affecting personnel. Having a central kitchen, which again is going to decrease the number of employees by 5. So you're still looking at cuts in employees. You're going to increase your mileage expenses because we're going to have to pay for transportation from whichever site the central kitchen is at to the other meal sites. And then again, it's something that was proposed before, and due to the responses from the public and the supervisors, it was voted down. And then the only other option would be to create a waiting list for home delivered meals. So instead of anybody that calls up being able to get a meal and starting the next day, they'd be on a waiting list and they wouldn't be able to get the meals until someone else came off the meals. And that would also result in letting go of employees because you wouldn't need as many staff members. And again, I want to reiterate that based on the funding sources and how much we are required to contribute and how much we do out of the county coffers, the home delivered meals and the congregate meals program was the only area where we could make cuts in order to save the money. The other programs, if we made a cut, it wouldn't be a savings to the county, and it would hurt the individuals.
So you're saying which meal sites that you could actually cut, like another employee would be like Chestertown and Johnsburg?
Yes. And it wouldn't be cutting an employee, it would just be decreasing their hours.
The hours, okay.
And that's based on the number of work that they do in the spreadsheet. The spreadsheet here based on what the NYSOPA has given us. And the Cedars employees themselves, they did say, why don't we just cut one person instead of all of us, or why don't we decrease the hours? So that's why this one is in there.
Okay. Committee members looking for your input. Supervisor Lowe.
Thank you, Madam Chair. And with your permission, I'd like to address my input to our guests and the committee.
Go ahead.
On Thursday, we had a meeting with Cedars management, John Hunt and Kaylee, and the purpose of which was to discuss the issue of what we perceived as the value gained by a private for-profit company, the value gained from the Cedars site. Now, as you know, what goes on there is fantastic. The ambiance is great, the quality is great. There's nothing that can be said negative about the Cedars program. Cedars management agrees that there's value added. And in the discussion, they said, yes, we agree. Well, they agree that there's value added, but they also did a calculation and felt that that value still would be there whether it was produced the food was produced completely at the Cedars or only partially but primarily at Washington County. So they had no feeling of or inclination to offer any compensation to the value added. Our feeling is that there's could be a legal issue as far as private money supporting their, or public money supporting their private profit system. If they had come back and say, we're gonna compensate that. We perceive there's value added, so we're gonna pay something back to the county. They weren't interested in that. So to them, it's 6 1 half dozen of another. I like the idea that since Bolton is contributing to the meal site in Bolton, Lake Luzerne is contributing to the meal site in Lake Luzerne, Chester, same. I think it would be appropriate if everybody's from Queensbury. I don't see anybody from Glens Falls. Is anybody from Glens Falls? So let's pick on Queensbury. And since there's so many Queensbury supervisors here, that apparently, perhaps it would be appropriate for the town of Queensbury to compensate the county for our expense. And they could deal with the actual process of the legality. But right now, I don't have a choice. I'm not comfortable with having public money go to support a private for-profit company. And the quality of the meals, everything is going to stay the same except for where it's produced. And this issue of Washington County, money going to Washington County, very likely every paycheck that's paid in Washington County is spent in Queensbury. So I don't think that's an issue.
How about other committee members? What is your feeling? All right, Mr. McGowan.
John. Is this something maybe Queensbury might want to entertain? Is this, contributing toward since there are so many Queensbury, and also Glens Falls? Is this something you can bring back to your head honchos?
Be happy to, and in addition to that, we'll provide some additional information. Yeah.
Brad, this is not new. Queensbury and the city have contributed before. Why we weren't asked to contribute going forward, I don't know.
But it's something we could entertain?
No. I got to say that I have to agree with Mr. Dibbitt, what he said earlier. And I also have to agree with Mr. McDivitt and many others that D is a superb Department of Energy. But I still think that the service should stay in Cedars, in, Warren County, etc. Supervisor McDivitt expressed it well.
No, and I see that, but would that be something that Queensbury could entertain on your board level of maybe contributing a little along with Glens Falls to help out?
We used to do that, right?
Right. Can we used to do it again?
Nothing imposing.
Okay. Thank you.
All right, we're running over time, so I guess I want to know how you want to deal with this. All right, Supervisor Conover.
I just want to make sure this item 4 saves approximately $51,000. This is basically bringing all of the centers into state standard time.
Yes.
So under this proposal or this idea, we would achieve $51,000 worth of savings. It would have been more actually if we had to put some months back on hold. Also would have achieved. That would have been added to the total as well. In other words, if we're still at 2 involved, that would. So I find this proposal this plan very intriguing.
All right, because that's what I want to know from the committee. Do you want to drop the idea of the Washington County and go with what D has down for number 4 that saves like the 51,000? Supervisor.
Thank you, Madam Chair. My suggestion would be to follow, I do agree with Chairman Cano. This is a good proposal right here. We'll save us 51,000. And if we could take the difference, which would be roughly 25,000 back to Queensbury and the city of Glens Falls. I mean, this is a budgetary item. to be brought back next month. You know, if they can, or have some ideas, or they can fund the difference, we could follow through with the cuts and fund through the town and the city Glens Falls.
How does the rest of the committee feel about that?
That would be fine. I would like to, before we make a decision to drop Washington County, I would like to get the response from Glens Falls and Queensbury, but that seems like that would be okay.
Okay.
I don't think we ought to vote on it today. I think we've been given a fair amount of information.
Right.
Here. So
Can we come back next month and
that's what I
discuss
would
it?
say.
In the meantime,
Make a decision, yeah.
we can get some information from Queensbury and Glens Falls and see if they want to
Exactly, yeah. I
look in a
mean,
bit. Anyone else have any other thoughts? Mr.
No,
McGowan?
I agree. I think that's a good move.
All right, so then that's how we're going to move forward with this. Then we'll come back next month. We'll kind of decide what we think is the best way to go. All right, we'll go back to G. You have a couple of other things, I know, because there's another committee waiting.
So the last thing that I just wanted to speak to is every year the New York State Office for the Aging has each county designate 2 seniors that make a outstanding voluntary contribution. This year, our Senior of the Year for Warren County is Virginia Raymond from North Creek, and our contributing Senior of the Year is Daisy Kavanaugh from Lake Luzerne. We also have Lillian Finney, who was our Senior of the Year last year for Warren County. We are going to have our senior luncheon on Friday, June 1st. We are working on the location at this point, but as soon as we have that narrowed down, we will let our seniors and our supervisors know, and we hope that you'll be able to attend that luncheon. It's very important to recognize our seniors and all of their contributions that they make.
Oh, definitely. I think it's a wonderful program. Now, before we wrap it up, I know you people have been very patient. If you have something that you'd like to speak very briefly to, like I say, there's another committee waiting. Yes, sir.
Okay, thank you.
Mm-hmm.
Possibly the Queensbury person, supervisor, and the Glens Falls supervisor can go over to John Hunt, and maybe the 3 of you could agree on how you would portion a contribution. If there's a $51,000 that would be saved under this new proposal, then you're looking for $25,000. Maybe Queensbury, Glens Falls, and John Hunt could get together and discuss how they could all share the cost.
All right, that's a good suggestion. Anyone else? Yes, ma'am.
Dr. Lowe, I had a question. When you went to that meeting with Mr. Hunt, didn't you ask for the rent, free rent, and some compensation from them? I mean, that was your proposal to them, right?
That's correct.
So, don't you think that's a little ludicrous to ask that much? You want them to give you free rent and not pay anything for utilities or garbage, and you want them to pay you so they can have the use of that building. I mean, I could come in here and have a party and let you fund it all. Does that sound right? I mean, somebody in their right mind as a business, they can't afford to do that.
The number you said, the free rent plus the extra, the number was $25,000. It would have been appropriate for him to say, no, we can't do $25,000. Well, what can you do? He said, well, we don't want to do anything because we'll get the same benefit if we go to Washington County. So there was no counteroffer.
They're getting their full benefit of that use of that building. Right.
In Mr. Supervisor Loeb's defense, we have tried...
Excuse me, could we let Dee respond to that, please?
We have tried to negotiate with Cedars Management to have a lesser rate, and it's very difficult. They want what they want. We've even tried to give them ideas of how they could save expenses with trash removal, with electric, with things, and we still came at the same $14,500 for the year with a built-in increase, and that's only going to go up. So it's not just that Supervisor Loeb went to them and said, we want free rent and $25,000. We were trying to see if we could come up with a compromise, and they weren't willing to compromise at all.
She's right. All right, Supervisor McGowan, it'll take a couple from here, and then we need to wrap it up.
Yeah, I just want to say, I also attended that meeting, and I tried all my negotiation tactics to, get a couple dollars out of them. And they said, no, thank you. It doesn't matter whatever's in there, they'll benefit from it, so, or
That
not
was-
benefit from it, but it will.
I have heard
All right.
going on at that
Go.
meeting they said you people were asking the impossible from them.
I don't think so. I was at that meeting too, and I didn't think we were asking the impossible.
We were told.
Well, it's interesting how you weren't at the meeting, or whoever came back to you.
The situation is, we've got another building you people have approved. There's going to be that many more apartments there that are going to be eating there. And you're taking this away from the Cedars? It just don't make any
Well, we haven't
sense.
taken anything away yet, and if you listen to what we just said, we're coming back next month to decide which is the best way to go. We have another option on the table. It's a way of saving money without making any drastic changes there. So I think you're going to have to be patient until we meet next month and we make our final decision on that. One last comment. Yes, sir. The one with option 4 is making cuts in staff at some of the other facilities. Oh, yeah, but we still would have to do the other in order to save the $50,000 and then see what they could come up with from Queensbury and Glens Falls. One last comment, Mr. Beatty, and we need to...
Thank you. You know, this option number 4 says $51,000 savings, but $42,000 of it comes from cutting at the Cedars. Now, maybe my math is wrong, but $42,000 out of 51 comes from cuts at Cedars. So I will be totally opposed to that if this ever tries to get to the floor. That's not acceptable.
But if you can perform the same service with less staff, I guess I don't see a problem with that.
You don't, and
No,
I'd be
okay.
glad to discuss it, the business aspect of it.
All right. Anyone else on our committee?
Can we let our former treasurer say
Last
something?
one.
Frank O'Keefe from Queensbury. I think everybody knows that I'm opposed to this move, but I'm going to go with that. But we've been doing this for over 40 years that I know of. I've been a volunteer for 26 years. That you have a $153 million budget. Now we're arguing over 74,000, I correct Mr. Beatty, you said 75. It's $74,000. That I've reviewed all the analysis provided by Mike Swan. They gave me all these reports for over a year. Here they are right here, if anybody wants to see them. Every supervisor got these reports. And it's a budget analysis. If you have any problems in the department, they show up here. Well, there's a lot of departments do show up here. I'm not going to name the departments that are really multi-thousand dollars in deficit each and every year. But nowhere in these reports do I see that there's a big problem in the Office of the Aging, especially the Meals and Wheels program. Absolutely none. There's 2 items in here where they were over budget on a line item, but at the end of the year, no report. So you'd have to assume that there is no problem. If there's a shortage of the funds for the Meals and Wheels program, it should be put back in here. I was a mayor in Glens Falls for 8 years. I was the treasurer for another 15 years. I never heard of a request from Warren County to fund the Meals and Wheels program. I think if it was, we would have contributed, and I'm sure that Queensbury would have done the same thing. Another thing is that I read in the paper that Washington County does have problems now. They have budget problems. Another thing was that the Sheriff Murphy said that they wouldn't have any more additional employees by taking on 300 meals. And then they advertised in the paper that they want two more employees. So I don't know if Washington County supervisors realize that, but if the program is switched to Washington County, it's going to add 2 more employees. So I just passed that on, and I think I'll call the budget officer and the treasurer who I know in Washington County. But the analysis and everything else, it doesn't make any sense to me to move this program, and I don't know how you would transport all these meals from Washington County into the Cedars every single day and not lose something. To address Mr. Lowe, you should thank God that Cedars is providing this service. When this program first started out, we were over at the hospital. They kicked us out of there, and then we went to the Baptist church. The state kicked us out of there because it was inadequate. The Cedars picked it up, and it's the nicest facility that one could have. And it really doesn't add to the quality of Cedars to provide more money to keep this program. It's really costing them money to do this because they got a beautiful facility there. And I wish people would realize that, and maybe some of these supervisors should get out there and do volunteer work and see actually what a service that the Cedars does to this county.
All right, thank you, sir. I'm going to entertain a motion to adjourn. We're way over our time, and there's another committee waiting.
I do have a question.
Okay.
I don't know how the Cedars can still be used as a distribution center if they no longer have this service in-house. We aren't going to be able to have another provider for meals for the people who live there and have those just going on as a distribution center at the same time. That area will have to be used for our own facilities.
With that, I'm not familiar, so I can't answer that. I don't know if, maybe Dee could answer that.
Thought of another place as a distribution center.
We do have a backup if Cedars is not agreeable to it, but we've talked with Cedars, and they're agreeable to allowing us to still use their space as a distribution center.
Now that they are going to provide us with someone to bring our meals in. A caterer. How can they have that caterer working in that same area where you're distributing meals? It isn't going to work.
So they're looking for someone else to provide the meals to you guys?
Yes, they
Then perhaps we don't need to anymore.
That could be. All right, I think I'm going to entertain a motion to adjourn. We have something to discuss or think about before next month. Supervisor Sokol, seconded by Supervisor Hyde. All those in favor? Aye. Opposed? Carried.
Thank you.